The coronavirus global pandemic has impacted many sectors in Nigeria, including the economy, which has resulted in income losses, job losses, health concerns, amongst others. The COVID-19 National Longitudinal Phone Survey, COVID-19 NLPS, is a part of the World Bank's efforts to monitor the evolving nature of the pandemic and measure its impact globally. In the 10th of a planned 12 rounds of the COVID-19 NLPS of households in the country conducted February 6 to the 22nd, 2021, the impact of the pandemic on employment and livelihood, share of Nigerians deploying safe practices to prevent the spread of the disease, and vaccination concerns are the focus. According to findings on employment information from working-age individuals between 15 to 64 years, data shows that the share of Nigerians who were working in February 2021 was only slightly lower than the share working in September 2020 and higher than the share working in January-February 2019. But the working situations have been most volatile for individuals living in poorer households. Regarding people's concerns about the COVID-19 crisis and their attitudes towards vaccination, the vast majority of respondents had agreed to be vaccinated, while 65% of respondents reported that they were very worried about themselves or someone in their immediate family becoming seriously ill from the disease. The share of Nigerians deploying safe practices to prevent the spread of the virus, including hand washing and mask wearing, includes about 76% who reported wearing a mask when in public in February 2021, compared to 60% in November 2020 and 72% in August 2020.
Professor Titolola Obilade, Associate Professor, Public Health, Nile University, Abuja, joins us from Abuja studios. Thank you for joining us on the program. I want to start with the survey's report on vaccinations, which shows that majority of respondents would agree to be vaccinated, with people in rural areas showing willingness to receive a jab, unlike respondents in urban areas. I mean, one would think that it would be the other way around.
There are many ways we can look at this. You remember the study was conducted in February, and during those months, from January to February, we had increasing cases of the COVID. And so there was a fear factor there, and so people were ready to do anything. That's one. So it could be that the people that responded were like out of fear because they can see the cases rise and they'll do anything. And prior to that, the vaccines hadn't reached here. They had not had cases of blood clots. There was no fear factor there. That's a different type of fear factor. So the fact that they saw cases rising after an initial dip some months before that time will put them to say, oh, they want to get vaccinated. Another thing you can look at is that during the correspondence from the phone conversations between those who were interviewing them and those responding, as it is with things with government, they might feel, oh, maybe if I say I want to get vaccinated, maybe they'll give me something, a token something. So that effect is still there. You know, they could say, well, you know, let me just say I want to get vaccinated, you know, so I can get something out of it. Who knows? And so that factor, we do not know how much of that factor that played there. But definitely, everyone that was able to respond will have noticed that there were increasing numbers of COVID-19 cases, not just in Nigeria, but all over the world. So at that time, and we didn't have any vaccine at the time, so they will definitely say they want to get vaccinated.
Unemployment, we had more women working higher than previous, and more in commerce industry, looking at the breakdown with the NBS. Would you say the pandemic impacted women more than men in more ways than one?
Right. Yes, the pandemic definitely affected women much more than the men. When we have two working breadwinners in the household, okay, even if you have in academics, you realize that the burden of children, taking care of the children, it falls on the woman. And in the case of maybe in the respondents of what we have seen from this survey, the women are more able to get simpler jobs. When I say simpler jobs, if you can cook, you have a pot at home, you have a cooking spoon, it doesn't take that much to be able to get some food together and say you are selling, because food will always sell. And then we also have women that are able to go into childcare, because for those who are able to work and maybe their schools had not yet resumed for the children, then more women are able to say, oh, well, you're not doing anything. Let's start doing some child care. And so they find out that they can have the informal sector, which has expanded for them. So this type of thing, selling of foods, taking care of children, including their own children, it gives an extra income. And then at the month that the survey was done, the economy was down. I mean, we're still trying to expand on our economy. But the time the economy was down, a lot of Nigerian households were trying to get more money in. And so, like the saying goes, it's just not one road that leads to the market. So every available means, and then the kind of jobs that women will do is more malleable than what the men will have to do. They might have to go to the service providers to be able to get their own jobs done. But the woman, just the woman alone, she can do the home care. And then some can also become caregivers on one-on-one. You know, so they're able to do those type of things. They can become cooks. And so there's a variety of jobs that more women are able to do. And the women in the home, they have this thing that, oh, they can't just wait and starve. You know, they've got to find a means of getting things done. So you find out that they're able to, like, something must be done. And so that's why you can have more women going into the labor industry.
Finally, Professor Obilade, further surveys are expected to be conducted. Do you see this assisting policy decisions, healthcare transformation, you know, as we exit the pandemic?
Well, yeah, actually, you know, this survey was done in February. That's almost 2 months away. This is now April. So the time the survey was done, it should have been excellent. I mean, if the results came out within a week after completing the results, you know, completed survey, because the things that were in effect then, if we look at it now, it's kind of past the event, because then we're having some lockdown, the vaccines had not yet gotten to Nigeria, some level 12 workers were still staying at home. So a lot of things were there. There was a lot of fear. And then when the vaccines came, because like in the now, when the vaccines had come, there's still the hesitancy there, there's still the reluctance there, you know, there's still the conspiracy theory there. So when people are even getting the vaccines, they're like, oh, why are we getting this particular one and not that other one? And so the fear that is here now in the month of April is different from the fear that they had in February. But as to your question, that does it actually play a part? Yes, it does, because we can always extrapolate and like, well, if this happened 2 months ago, okay, let's see how things will change in the next survey. And so we can do some balancing act and say, okay, how do we go about it? Which is where we'll talk about the primary healthcare centers. You know, like I was saying, I write it in one of the national newspapers, and primary healthcare is one of the reasons, you know, that we can key into to get people to reduce their fear factor when they have somebody from within their community talking to them, like a village health worker, a volunteer health worker talking to them. They see them in the community and they're like, these are the fears I have, which is different from having a stranger, a foreigner, someone that is not in their community, coming to tell them that, go take the vaccines. They need, so you see, if you can handle the fear, then we're able to progress further in getting people to get vaccinated. We're able to progress further in getting people to comply with the COVID-19 protocols. And that person comes in from within the community.
Thank you so much. We appreciate your time and your insights into the issue. Professor Titilayo Obilade, Associate Professor, Public Health, Nile University, Abuja. Thank you for your time.
Thank you so much for having me.